Some of the state's leading trauma doctors have slammed a Min's government plan allowing medicinal cannabis users to get behind the wheel. Experts say the proposed 3 strikes policy will cost lives.
A blunt warning tearing down the government's new drug driving policy.
If this bill goes ahead, we will see more body bags.
20 of the country's leading trauma doctors co-signing an open letter calling for the government to ditch its plan to allow prescription cannabis users to get behind the wheel.
This is a bad bill. It's dangerous. It should be taken off the table.
Under the proposal, medicinal cannabis users that test positive for the active ingredient THC would be banned from driving for 24 hours. But if their sample only has trace amounts, they will not face conviction for their first 2 offences under a 3-strike rule. The government says it's a common sense approach for the state's 300,000 medicinal cannabis users.
We think that this gets the balance right between road safety and keeping people safe.
But some doctors argue while there is a well-established scientific reasoning behind alcohol's 0.05 limit and impaired driving, there is no such evidence for THC. In fact, it's the opposite.
Every one of those science studies demonstrates the degradation of 8 of the executive functions involved in the task of driving.
Drug driving now claims more lives on New South Wales roads than drink driving, with cannabis present in almost 70% of drug-related fatalities over the past 5 years.
With record fatalities in New South Wales, now is not the time to be proposing these laws.
Let's go live now to Taylor Aiken at RPA Hospital. Taylor, the Min's government has pledged record health funding.
Yes, $10.3 billion committed over the next 4 years, delivering more beds and more health staff. The funding will assist in paying for an additional 9,000 workers over the next 4 years to maintain safe staffing levels across existing and new hospitals currently under construction. The nurses will also be paid more following an Industrial Relations Commission decision to grant nurses a 16% pay rise, which we now know will cost the budget an additional $2.9 billion. The Treasurer insisting no cuts will be made elsewhere to pop up the state's growing public sector wages bill.
It's a fair investment in the wages of the state's nursing workforce. The state can't afford it because we have fixed a lot of what was going wrong elsewhere in the budget.
Health shaping up as a key part of Daniel Mookie's state budget, set to be handed down next week.
Taylor Aiken, thank you.